Well, I'm just so pleased to be joined by Dr. Petra Wildgoose. She's the lead of the Young Adult Colorectal Cancer Program at Toronto's renowned Sunnybrook Hospital, with a wealth of experience when it comes to early onset colorectal cancer. Dr. Wildgoose, just explain for me, if you would, what you have seen throughout the course of your medical career in terms of a surge in unexplainable cases of early onset CRC.
We have seen an increasing incidence since at least the 1980s. We established our program in 2019 in response to the increasing incidence that we were seeing at Sunnybrook. And since 2019, we've seen more and more patients. Even in the last few years, the patients are getting younger. The disease we're seeing is more aggressive. And the disease is very difficult to treat in younger patients compared to older patients. So the outcomes are very different as well. And it's we don't really know why. In fact, we don't know why. There's research being done, obviously, and a lot of things are pointing towards the microbiome and things that impact the microbiome and the development of cancer. But the reason why we established the program is to address the unique needs of younger patients and to help to address the increasing incidence. So we're working together as a multidisciplinary team with surgical oncologists, medical oncologists, radiation oncologists, and myself to really change the treatment pathways to figure out how we can better address this disease in younger patients, which is biologically different and more aggressive to treat. And so it's a work in progress, but certainly we have seen a significant increase, not just prior to 2019, but since 2019 as well.
Mm-hmm. So a couple of things about being an early onset colorectal cancer patient. Number one, is it not a fact that the vast majority, somewhere in the range of 70+%, are diagnosed late stage, and there's a good reason for that? Can you just talk about that a little bit?
Yeah, unfortunately, in younger patients, they are more likely to be diagnosed with stage 3 or stage 4 disease, 75% approximately. And it's really devastating because younger patients don't anticipate getting a colorectal cancer diagnosis. And then to be told that you have stage 3 or stage 4 disease, you can imagine the mental health impact that has, just the diagnosis of being told that, just the diagnosis itself. And then, of course, the impact the treatment and the path moving forward can have on both physical and mental health. Stage 4, obviously, meaning that it has metastasized or spread. This does not mean that there aren't, therapy and treatment options for potential cure, but it means that the treatment for stage 3 or stage 4 disease is far more aggressive with increased side effects and increased impacts on quality of life. So it means that these patients are going to be treated for much longer and treated far more aggressively, and they're going to have increasing impacts on things like menopause, things like sexual health, things like body image, fertility, sleep, exercise, mood, their ability to return to work or enter their education, take care of their children. It impacts all areas of life compared to, for example, a stage 1 diagnosis. So there are significant downstream consequences to having a diagnosis at a young age, let alone a diagnosis that's stage 3 or stage 4.
And often they're not caught till stage 3 or stage 4 because of a couple of sort of dovetailing factors. One being nobody expects somebody in their 20s and 30s to get colorectal cancer.
That's right. And also the fact, patients are symptomatic for, significantly longer under the age of 50 compared to over the age of 50 before, being diagnosed. And it's because patients think, wow, it must be hemorrhoids or, it must be something else that, they ignore their symptoms because they don't anticipate having, a cancer diagnosis. And same with healthcare providers. Healthcare providers don't realize there's this increasing incidence or, to say maybe we need to, do a colonoscopy for your symptoms. And so it takes, for multiple reasons, it can take much longer for patients to be diagnosed. And when they get to the point of being symptomatic, that really means that their disease has progressed to a significant state. So, decreasing the screening age means that we can catch cancers earlier and hopefully decrease the impact that, cancer and its treatment has on the patient, including the impact on quality of life.
Hmm. There is a trend globally now to lower the age for routine screening, which would mean a fit test looking for blood in the stool and a referral to colonoscopy if necessary. But there's a global trend now to lower this routine screening age to below 50. We've seen it in the United States and Australia. What argument would you make to both the Canadian federal government as an advisory in an advisory capacity, but also to the provinces? How would you argue to them that this screening age needs to be lowered?
Well, I mean, it's true. You look at the statistics, it's only about 8% of patients that are early age onset out of the entire population that's being diagnosed with colorectal cancer. So it's a small percentage, but the issue is not just that. The issue is that they're stage 3 or they're stage 4 upon diagnosis. And this means significantly longer treatment, significantly more aggressive treatment, more treatment, increased side effects, not just for the patient, but for the patient's family and the impacts it has on society. So, the downstream consequences are numerous and they're costly to the patient and to their families and to the healthcare system and to our society as a whole. So, taking all of that into consideration, there's a huge cost to having a diagnosis of colorectal cancer under the age of 50. To decrease the screening, even just by 5 years, we may have a huge impact on not just the patient, but their family and society because we're catching it earlier, which means we could catch potentially cancers before they develop at all or before they develop to become stage 3 or stage 4 disease, meaning their treatment and their outcomes and their side effects are significantly different.
I mean, we could save hundreds of millions of dollars in the long term, but more importantly, we could save thousands, if not tens of thousands of lives.
Exactly.
Hmm. What do you make of the current trend? Are you pleased to see this direction in this campaign? What's your response to what's happening in Canada now with a growing momentum to lower the age?
Oh, I think it's not just, I mean, it's it's overwhelming because I think we started this clinic in 2019 with very little awareness about the increasing incidence, despite the fact that we've been seeing this for decades now. And, for this to now be on the cover of the New York Times and The Economist and Globe and Mail and CBC and uh, it's and this has been in the last couple of years. It's really it's positively reinforcing the work that I'm doing and that many, many oncologists are doing across the country to work with this population and to minimize the impact this disease is having on them and their quality of life. And we're all doing our best and we're all trying. So to see this push in Canada and globally towards identifying that there is an actual issue, and then to say, what can we do about it is, even more overwhelming. And I couldn't be more thrilled to see that, for example, Colorectal Cancer Canada has said we need to lower the screening age. And I think that's absolutely right. I think there's a more push, like you said, across the world to lower the screening age. I think that's absolutely the direction we have to go.
And then to physicians, what would you say about sensitizing them to this as a potential diagnosis for their patients who come in, or probing more, no pun intended, but probing more with their patients with regard to what they might be experiencing that they're not sharing? I hear from a lot of patients, and you've alluded to this, they will have, they will be symptomatic and brush it off as something else. And their doctors may not know they're symptomatic because they're not reporting blood in the stool or pain in the rectum. So, what would you say to doctors and to patients about that, opening those lines of communication and being more aware that this could be a diagnosis for someone under the age of 40, even?
Yeah, I think what we can really do and what, even just by lowering the screening guidelines, what we're doing is we're bringing awareness to it, right? We're not capturing everybody. Certainly, we have patients in their 20s, early 20s, who are diagnosed with colorectal cancer, and that's increasing over the past few years. So, we need to just bring awareness and educate. The number one thing we can do is educate the public and healthcare providers about the signs and symptoms, and that it can happen in people in their 20s, 30s, and 40s. And um, I hope that, we can lower the screening age, but by doing that, we don't want to give a false sense of security to patients or to the public that, it's only happening in people who are 45 and up, because that isn't the case. My hope is that this will just push awareness amongst all of us that this is a disease that we all have to be aware of, and that we have to ask about. It's the onus is on the healthcare provider, but unfortunately, patients still have to advocate for themselves and be aware because For example, many Canadians don't even have family doctors. For them to be aware of the signs and symptoms and to seek healthcare advice through whatever means, or a fit test or whatever it might be, if they're eligible for screening, is very, very important.
Mm-hmm. Thank you so much